So during your penile implant operation, we inject lidocaine numbing medicine around the penis and the drain site, and we also inject that inside those cavities where those implant cylinders are going to go, and that significantly reduces post-op pain or discomfort. We're going to give you some pain pills in the operating room and some pain medication through your IV. Afterwards, you're going to go home on a narcotic pain pill that you take as needed. And then we're also going to give you an anti-inflammatory as long as you don't have any contraindication for that. Contraindications may be bad acid reflux or stomach ulcer disease or kidney problems. It's nice to take that anti-inflammatory, which may be Toradol or Celebrex, continuously during that first 48 to 72 hours, and then take the narcotic pain pill on top of that. So what are some things you can do to reduce swelling after your penile implant surgery? Number one, we're going to give you an anti-inflammatory. So that's not a narcotic pain medication, that decreases swelling. You're going to take that around the clock in the beginning for that first week. Second, you're going to put ice on there for the first couple of days, 20 minutes on and off as needed to help with the swelling. We're also going to leave a little drain in that we use for plastic surgery. That drain goes to a bulb suction that sucks the fluid out of the sac or the scrotum, and that greatly is going to decrease postoperative discomfort or pain. We usually take that out about 3 to 5 days later. Then of course there's some scrotal support that you may use as well to help further decrease discomfort. So all the sutures we use are dissolvable. Okay, there'll be a little glue over the suture line. Don't pick at it, just leave it alone. It'll eventually fall off just like a scab. You don't have to do anything else to the incision. There'll be a little bandage on there that you take off within 24 to 48 hours, and a little bandage around the drain site that you just leave on or change as needed until that drain is removed. So one thing that's very important is to pull down on the pump that's in the scrotum in the postoperative period. We want you to start that as soon as possible. 48 to 72 hours after the procedure is best. The way that we do the implant surgery most commonly is through an incision above the base of the penis. So everything goes in through there. So the pump is down in the dependent portion of the scrotum. But if you're sore, you're sitting on there, you've got a lot of tight-fitting clothing on, pushing that pump up, and you're not touching it, sometimes it can migrate up. And we definitely don't want it to migrate up and get stuck or scar in place. So it's very important before all that scar tissue and healing develops and is mature, you want to pull that pump down and make sure it stays in the right position, because once it's healed, it's hard to fix if it's too high up. So basically, you've got that pump down there, you're just going to reach up in the sac of the scrotum, just like you can feel your testicle, you could feel this pump. You're going to get above it, and you're just going to pull it down towards your feet. Just kind of massage it down there, and make sure it's staying down there, hanging low, right between the testicles, where it's going to be easy to grab and manipulate for when you start using your device. So in terms of lifting restrictions or bathing restrictions after the implant, I usually tell guys no heavy lifting or straining, nothing more than 10 pounds for that first 4 weeks. At that time, you can do whatever you feel up to, including sexual activity. In terms of bathing, okay to shower in 48 hours, but just sponge bath around the drain site. And then at 2 weeks, you can go ahead and tub soak if needed. So in terms of when you can return to work, it kind of depends on what kind of work you do. If you're working a desk job, at the end of the first week, if you feel up to it, you can go back to work after you get your drain out. Almost everybody is back to their normal work at 2 weeks, unless you're doing really strenuous heavy lifting, and then it may take a little while longer, but certainly usually not much longer than that. At 4 weeks, you're basically free of any restrictions whatsoever. In terms of driving, really it's all about pain medication. If you're taking narcotic pain medication, then you can't drive. But if you're just taking over-the-counter medications and you're off all the narcotics, and you can drive as early as the next day. In terms of recovery after the implant, it's typically about 2 weeks doing your normal daily activities and 4 weeks for real strenuous heavy lifting, manual labor. At 4 weeks, we basically let you do whatever you feel up to, including sexual activity. So in terms of when you need to call me for any concerns or problems after the implant, number one would be any kind of fevers or chills. Pain not getting better each day, but gradually getting worse would be something I want to know about. Same thing with swelling. After those first couple of days, swelling should start to go down. If it's getting bigger and worse instead of better, I want to know about it. And lastly, any bulges in the groin, concerns for a hernia, you definitely want to give us a call. So all of your appointments will be made for you after the surgery before you're discharged home from the hospital. You'll have a post-op visit with nursing in about 3 to 5 days to take out your drain. And then I want to see you back in that 2 to 3 week window. And we're going to give you some educational material and show you how to start inflating and deflating the device. So we typically have people start to inflate the device at 2 to 3 weeks after surgery, and then really around that 4-week mark we let people start to use the device for sexual activity. And most people range from 4 to 6 weeks in terms of when they really feel comfortable having intercourse with the device. So there are 2 ways to contact us after your implant for any questions. Number one, we have a patient portal that you can send messages similar to email that will go to my nurse and myself, or you can call us at the office 573-499-4990 with any questions.